Hello, this is Dr. Gay from First Look MRI, and this is a normal MRI of the pelvis in a young woman just to show the normal anatomic relationship between the uterus, which is here, and the bladder, which is here, and the rectus abdominis muscles, which are the muscles in the front of the abdomen and pelvis. This vertical dark band is the rectus abdominis muscles. It comes down and attaches here along the front of the pubic bone. This is the pubic bone here, and this is the bladder, and behind the bladder, it kind of hangs over it a little bit, but mostly posterior to the urinary bladder, we see this structure, the uterus. We have the top of it, the fundus, and then along the bottom here is the cervix. This is the cervix, and this is the colon wrapping around. We note that the cervix is down in the pelvic floor, very low. The only thing lower is the colon here. And again, notice the uterus is behind the bladder, not above the bladder. Now, a patient came in here recently, and she had an MRI of her pelvis, and her uterus looked like it was in abnormal position. So rather than sitting up, rather than sitting down low, the cervix is pulled upwards. This is the bottom of the cervix. Should sit down here low in the pelvic floor, but it's pulled upwards. And the uterus looks like it's pulled anteriorly, and it looks like it's stretched over the roof of the bladder. Rather than sitting comfortably behind it, it's pulled over the top. And she had recent liposuction, a tummy tuck procedure, where they went between the rectus abdominis muscles and went in there and did liposuction and then sewed it back together. And she has an unusual finding here to the right of midline. If we go to the right of midline, this is the uterine fundus, and part of the uterine fundus looks like it is tented anteriorly, and there's a little linear black line that comes off from the fundus into this rectus abdominis muscles, right where she had the incision. Now, if we look at another view, I'm going to try to make sense of this. This is the bladder. This is the right rectus abdominis muscle, left rectus abdominis muscle. This is where she had that midline pelvic incision, and where they went in to do the liposuction. And we see that the uterus is here, and there's something that comes off of the uterus, and it's pulling the uterus forwards close to this incision. So it looks like this is the broad ligament that comes off the edge of the uterus on the right side. The left broad ligament is here on the left in normal position. But this one looks like it has been accidentally pulled into this incision and sutured down, and the uterus is just stretched forwards because of that broad ligament attached there. And with this abnormal configuration, the uterus is above the bladder. It's stretched across the bladder, and when her bladder gets full, she has to go to the bathroom, she says, much more frequently than she used to. She also has an unusual sensation of pain that gets worse when her bladder is full. The bladder stretches out and pulls things backwards, and she has a sensation of she actually can see that her muscles are pulled backwards, and that's because, again, the bladder is getting full, stretching the uterus out, and the uterus is attached by the broad ligament here to this incision, and this is tented backwards when the bladder fills. So she has newfound pelvic pain and increased frequency, needing to go to the bathroom more often, and it looks like it's related to this broad ligament that has been accidentally pulled into the midline pelvic incision. So she has a meeting with her surgeon next week, and hopefully this will be a really easy thing to do, just to go cut that and let the uterus drop down to normal position, and hopefully she'll be 100%. Thank you very much.